For a rectal temperature, ensure the patient's privacy.
Mrs. Thompson. Hi, I'm Jennifer. I'm going to be your nurse. Can I check your armband, please? Can you state your name?
Mary Thompson,
And your birthday, please.
January 1st, 1950.
Thank you.
And help her into a side lying or Sims position with her upper leg flexed. Move the bed linen to expose the patient's anal area while keeping her upper body and legs covered. Ensure that the anal area is clean. Put on gloves. Pick up the thermometer or remove the thermometer from the charging unit and attach the rectal probe with the red tip. Then slide a disposable cover over the probe, being careful not to press the ejection button. Insert the covered probe into an individual water-soluble lubricant packet. Dip the end of the probe into the lubricant, covering 1 to 1.5 inches of it for an adult. If you don't have individual packets, squeeze some lubricant from the tube onto a tissue. With your non-dominant hand, separate the patient's buttocks to expose her anus. Ask her to relax and breathe slowly. With your dominant hand, gently insert the probe about 3.5 centimeters or 1.5 inches into her anus in the direction of the umbilicus. Do not force the probe. Hold the probe in place. When you hear the audible signal and the digital display shows the patient's temperature, remove the probe. Discard the probe cover and wipe the probe with an alcohol swab and return the probe to the storage unit. Tell the patient her temperature.
Your temperature was 98.6.
And wipe her anal area with tissue to remove excess lubricant. Discard the tissue and your gloves in an appropriate receptacle. Raise the side rail and perform hand hygiene. Clean the base with an alcohol wipe and return the thermometer unit to the charging unit. As part of your follow-up care, document the patient's current temperature as her baseline, or compare it with her baseline and with the acceptable range for her age.